All right, y'all, it's Teresa, and today we're going to talk about the Transcranial Doppler, or the TCD. If you already watched my video, Circle of Willis, good for you. If you have not, make sure you watch it at the end of this video so that you can understand what are the vessels that are within the Circle of Willis or make up the Circle of Willis, and what are the vessels that don't make it up but is still important and related to the Circle of Willis. So let's talk about TCD, Transcranial Doppler. So what is TCD? TCD stands for Transcranial Doppler. It measures the cerebral blood flow velocities. Okay, the velocities in the TCD is the most important thing. Okay, that's what you're there for. And your approach is a transtemporal approach. So transtemporal approach, you are scanning over in this region, okay? You're usually using a sector camera if you're doing a visual TCD. If you're not doing a visual TCD, then you're using a small round camera, round cylinder. Yeah, you're using the camera, but you're still looking in this same area, and you're still looking for those velocities. Okay, that's the whole reason for the exam. So your approach is transtemporal. There are other approaches to do the TCD, but I'm going to go over what I know and understand. You do have the approach where it's transorbital, which is your eye, submental under your chin, and then also trans-suboccipital, back of your head. So then why do you do a TCD? So you can do TCDs for vasospasm, vasoconstriction. Vasospasm is a version of vasoconstriction, and it's a temporary or sudden narrowing of the vessels. Okay, so when you're doing TCD, you're looking for stenosis in these vessels. You're looking for emboli. You're looking for, sometimes you're confirming brain death. I have not had to use TCD to prove or verify brain death, but I have had to do an encephalogram ultrasound on a patient that was in an intensive care unit, and they wanted to be sure that there was no signs of alive tissue. So I did an encephalogram, and it was difficult to do because there was no drop of blood flow on that patient's head. So that patient was more than likely, So we're going to move on. TCD tracks changes over time. Okay. So if you come up, it might be a situation where you're looking at a vasospasm case in the ICU every day for like 3 days, because they want to track what those changes are, per day, every 24 hours. Also, TCD is done in sickle cell patients, and they're done routinely, and you're tracking the changes over time because you want to know if the patient is at risk for a stroke early. Okay. And let me just slide in here real quick. To my new subscribers, thank you. Thank you for over 100 subscribers. And if you haven't subscribed yet, there's still room for you. There's still room for more. Also, head over to my site, pathtopassing.com, where you can grab RVT in 10 days or Registry Ready in 10 days to help you prepare and pass your exam in record time, because we ain't wasting time. We ain't wasting money. We passing the first time. Bye. And then what is ultrasound's role in TCD? Ultrasound's role in TCD is, this is a Doppler based exam. Okay. So ultrasound sonographers doing this exam is very important. In some places you still have neurosonographers. I have not heard or met a neurosonographer, but in some places you do. It is a Doppler-based exam, so ultrasound techs are absolutely needed, okay? This is a non-grayscale version of an exam because you're only focused on the vessels. If you're doing a non-visual or a blind TCD, then you're just looking in that transtemporal region, and you're looking, you're knowing which vessel is where based on how your probe is angled and based on what the wave looks like and sounds like. Okay, so that's your blind. There's no grayscale. But when you do the visual, you would think you're looking at grayscale, but you're not. You're still just looking at the vessels. That's all you can see. And then in ultrasound, we interpret the waveform morphology and the mean flow velocities. And waveform morphology literally just means, what does the wave look like? Okay, does the wave look as it's supposed to look? Does the MCA look like an MCA, or does the MCA look like, the ICA or some other vessel? And if it does look different than what you expect it to look like, why does it look different? And that's things that you are communicating to your radiologist. And mean flow velocities. Mean flow velocities is the numbers that you are getting on TCDs, and that is what follows the patient over time. And the mean flow velocities in the MCA is usually what is the main thing that you're worried about. In some institutions, they do things, you know, beyond the MCA, but in all of the institutions that I have ever been a part of, the mean flow velocities of the MCA are what we pay most attention to. So that is TCD, the what, the why, the ultrasound. And then when we talk about the where, again, I want to show you that the where is up here. Okay. So if you've ever done a TCD ultrasound, let me know in the comments. If there's vessels that you guys look at that I did not talk about here today or on my Circle of Willis video, put it in the comments because I would love to learn more. Although my institution may not do it, that doesn't mean it should stop me from being able to understand what are all the parts of a transcranial Doppler. Thank y'all. Come back again for the next video.